We know you don't like Secretary Kennedy. Who's been your favorite HHS secretary in American history?
Yeah, that's not an important thing for me to answer.
Well, what HHS secretary do you like the best that you thought is a gold standard that Secretary Kennedy should be like? And have you ever complained about them on social media?
So there's no political tribalism with me. I don't know why you're acting that way. You say you guys.
Is that true?
Hold on.
What is the primary responsibility of a corporation? It's to maximize profits and growth.
But these industries, these multinational corporations are protected by the government.
That's absolutely not true. So SNAP helps to directly reduce food insecurity. If you put additional restrictions on it, it increases costs, so it's not as economically efficient.
Such a feeding of this chronic disease versus saying, no, we want to set you up for success. We want to break generational cycles of disease and not have it completely be funded by the American government.
Hi, I'm Dr. Will Cole. Wellness is a sacred art, and you are the masterpiece. This is the art of being well.
Okay, ladies and gentlemen, thanks for coming out. This is exciting. Been looking forward to this for some time. First of all, I want to thank Eudemonia for the opportunity to have this kind of panel, to engage in tricky, thorny conversations respectfully. I think that's more of what we need in our society. And I want to thank Jessica and Will for agreeing to do this. You guys are both either... You're both very brave or very stupid. I'm not sure. No, I just... So there's a kind of dual purpose to this conversation today. The first purpose is really to be able to demonstrate a model exemplar of how to have a conversation respectfully and constructively with whom someone you might disagree, right? And we don't do this enough in our society. The provenance of this conversation actually was this very stage last year. I was challenged to deliver an oratory on the art of having stressful conversations. This was 2 days before the presidential election, a very febrile moment in our country's history. I got two brave souls up on stage, a Trump supporter and a Kamala Harris supporter. And while they didn't agree, they found a lot of common humanity. And that session ended actually in a hug on stage. And they've since eloped, and they have a very centrist kid named Mitt. No, that last part is obviously not true. That first part is true. There are no hugs required here today. No pressure, guys. I mean, I'm always available for a hug. But so that's the first goal. Obviously, this idea exists within the context of the public health conversation. Over the last few years, health has become very politicized, tribal, and polarized. And, you know, in this particular moment, we have the MAHA movement led by Secretary Kennedy, who has undoubtedly brought the epidemic of chronic disease to the forefront of the American conversation. And there are those who very articulately argue that some of the performative wins associated with HHS serve as a Trojan horse and actually occlude the broader policies of an administration that is making America sicker. Okay, so with that set up, maybe we can seek some areas of agreement and connection. First, Jessica, would you agree that America is suffering from an epidemic of chronic disease? And maybe Jessica, you want to start?
Yes, of course. This is why I got into this field. So my PhD research was in chronic disease prevention, predominantly cardiometabolic disease, so type 2 diabetes, cardiovascular disease. This was 15 years ago, and it hasn't gotten any better. It's actually gotten significantly, slightly worse. Currently, we have a situation where 6 in 10 Americans are suffering with some sort of cardiometabolic or some sort of chronic disease. Most of that is cardiometabolic, so cardiovascular disease, type 2 diabetes, even chronic kidney disease. And 4 in 10 Americans, 40% of us, have 2 or more chronic conditions because multiple chronic diseases kind of collate together. And so when you have one, you tend to have others. Many of those have 3, 4, 5. And we have a situation where, it's not getting any better. And so, of course, we have a chronic disease crisis in our country.
Same question?
Yeah.
Okay. Yeah. I mean, my day job is helping people around the country get healthy. I've done that for the past 16 years. I love my patients, and it's a sacred responsibility for me. So I see on a daily basis people struggling, people trying to do the best they can, but are spinning their wheels. And it's becoming increasingly more complex. It's not as simple as just, eat healthy, don't eat these things. People are doing all the things, but are still struggling. So yes, without a doubt, it doesn't take an academic to look out in the world and see people we love in our own life struggling with health issues of all different kinds. So this, and maybe this is a good time to say this, like I'm representing the sort of Maha side of things. Like I'm not paid by the Republican Party. I'm not even a Republican. I'm an independent. Health is bipartisan for me. It's a human issue. There's no PAC or super PAC that pays me. I'm my own voice. And it's born out of something that what I've always done is just like what I see move the needle in people's labs and in people's lives. And to me, it's a human issue.
Okay. So we have some coherence there around the nature of the problem. I just want to now probe what you both think is actually the source of that problem. And I don't know, Will, if you want to maybe address that first.
Yeah. Well, I think it's a confluence of factors. I think I look at it through the lens of the research of looking at ancestral health and the fact that our genes haven't changed in over 10,000 years, right? But our world has changed dramatically in a very finite period of time. And you're looking at the foods we're eating and the foods we're not eating, environmental toxins, chronic stress, unresolved trauma. It's a perfect storm of variables that our world has changed so much in such a few generations. Like these genetic predispositions have been lying latent for thousands of years, but are being awoken like never before in human history because of what researchers call an evolutionary mismatch or an epigenetic-genetic mismatch. So the more we can do to decrease that chasm between genetics and epigenetics is how you get people's health improved, how you get their lives improved. So it's not just one thing. These are complex, big topics. As people spend their entire careers talking about just one of those topics. But when you start leaning in, the body's amazingly resilient. The body is amazingly resilient. I see people up against so much serious issues being able to reclaim their health when they start moving the needle and start addressing these components as to why we're seeing these chronic health issues. So it's not one thing, to answer your question. It's a combination, but it's things that we largely have agency over on a grassroots level, which is where I'm used to, but also on a public health level. Like we need to be talking about these big things to start to change hearts and minds, start to change systems to empower people for their health.
Yeah, so certainly there is individual responsibility involved in being healthy. There are protocols, many of which are espoused here at a conference like this, that people should and could adopt to be healthy. There's also this aspect that informs the ground conditions of health called the social determinants of health that add to the problem. So, Jessica, I know you've talked about that quite eloquently. Maybe you could address that in the context of that question of like, what are the primary sources of the problem of chronic disease?
Yeah, so in the United States of America, we live in an environment where, if you look at our food environment, it's not a food environment that is set up for the vast majority of Americans to succeed, right? It's by some estimate 70% ultra-processed food. We live in what's termed an obesogenic environment where the vast majority of Americans are eating too many calories for their needs, which causes weight gain and obesity, and that's why we see such high rates of obesity. We see the vast majority of Americans not meeting physical activity guidelines. 80% of Americans, 8 in 10 Americans, do not meet minimum physical activity guidelines, which is just 150 minutes per week. That's 30 minutes per day, 5 days per week. You see a highly stressful environment. When you compare us to other high-income countries, we have the longest working hours of other high-income countries, and we don't have any sort of social safety net programs. We don't have a paid leave program. We don't have any type of programs that are helping to alleviate any of that. We have millions of people working 2-3 jobs, working far more than what a full-time working schedule should look like. And our sleep is struggling. These are the pillars of health, right? Diet, exercise, sleep, stress. And we live in an environment that is not set up for the vast majority of people to succeed. And so we see that the vast majority of people are not meeting evidence-based guidelines for nutrition, for exercise, for stress, and for sleep. And so when you look at that, and you have to ask why. So we have this evidence of what could be helping people reduce risk of disease. It's what I studied in my program, and what I've been working in 15 years. We know what works. No one is adopting the behaviors. And so you have to ask why no one is adopting the behaviors. And when you do that, you have to look at a systems approach. And so I want to make very clear, when we're talking about public health, we're not talking about individual health. We're talking about the health of the entire country. And so when you look and you hear statistics like I rattled off earlier, 6 in 10 Americans have some sort of chronic health condition. When you look at that, you have to look at who is actually impacted by those chronic health conditions at a population level, because that's what public health does. And it's very, very clear when you look at a map of chronic disease in this country exactly who is afflicted by chronic disease. And it's not foolproof, it's not 100%, but it patterns very, very closely to any other map that you would put over it with social determinants. And so social poverty, for example, you put a map of poverty over a map of chronic disease, and they mirror almost perfectly. I did it yesterday in my talk. And you can see there's what we call the stroke belt, which is through kind of the southern states and up into Appalachia, up in the Midwest a bit. And those are the areas that are kind of concentrated with the most chronic disease. And so when we look over the last 40 years at public health data, what we see is that there's determinants of health. And so your healthcare is one of those determinants. Your individual genetics, your individual behaviors are determinants of your health. But the biggest determinant of health, and it's very consistent over the last 40 years, that when you look at population levels, not individual people, population levels, 55 to 70% of health is determined by what we call social determinants of health. And those are non-medical factors that directly impact health. Those are things like your access to healthcare, your access to income, right? Are you living in poverty? Are you living in a food insecure household? Your access to education, social community and context there. And so when you're looking at how can we improve population level health, you have to look at the social determinants of health and starting enacting policy, because this is all policy-based, and that's why public health has always been political, because you have to have policy enacted in order to improve some of these health outcomes. And so that's what I would say is the reason that Americans are really struggling is because we have underinvested for decades in public health programs and public health infrastructure, because there's not a lot of money in public health. And the United States really likes to invest in things that are very profitable.
Yeah. Can I answer, Jack? Is it okay? I mean, I agree with all of that stuff. I agree with all of it. And that's what's wild to me, because I think we have so much. I told you this before. I think we have so much in common, because I agree with that. I live in Appalachia. I live in southwestern Pennsylvania. I see it on a daily basis. I don't live in the bougie parts of the country. I like visiting them, but I love my simple life. And I see where we shop at Aldi and Costco and Walmart. I see my friends and family. My father-in-law is a farmer. I see this stuff. So this isn't just theoretical for me. I see it on my street. And to me, something that I would love to get to the bottom of it, because I think we look at policy, right? Policy is the current policy is based on the science. It's the current, what I would call cherry-picked science that is convenient to industry, right? They subsidize corn and wheat and soy and sugar. It drives these prices down. That's ultra-processed food that my friends and family get to have readily, and people around the country, that's what's available. But, I mean, all we have to do is, who has eaten hospital food recently? Or who has gone to public schools recently? Or the military? Or many other institutions? That's all based on policy, on the dietary guidelines, which is based on the science that says have grains and low fat is good, and these loopholes that happen where you can have a few grams of whole grains and you can serve cornflakes and Fruit Loops in public schools because it's based on policy. It's based on not just policy, but it's policy based on science. So I'm excited, I'm hopeful. Government is corrupt, government is broken, but I'm willing to champion wins no matter where they come from. And I'm hopeful of, apparently next month, the dietary guidelines that are coming out, and they're going to be talking about ultra-processed foods. I think that's a win, right? I think talking about more fruits and vegetables and less refined sugar, I think that's a win. That's the first time this has ever been talked about at a national level. And I've also celebrated wins when Bernie Sanders was talking about diabetes. I was cheering him on. I posted about it on social media. When Cory Booker talked about ultra-processed foods, I was cheering him on. And I will also celebrate wins with Secretary Kennedy, because to me, it's not partisan for me. And I'm going to be intellectually consistent, and it doesn't matter who says it, it's what they say. And even if it's incremental wins, because these are big systematic issues that aren't going to be solved overnight. But I'm hopeful that we're actually having this dialogue. So beyond the dietary guidelines changing and SNAP reform, and we could get into all this stuff, I see exciting wins. What I'm also excited about, this sort of swell of MAHA, whatever you want to call it, it's the hearts and minds. It's the increased awareness around these big issues. So at least on an individual level, people can start. I had a call with some corporate heads at Walmart a few months ago. They said more and more people are shopping at Walmart asking about things on the label. That's a great thing. So if government's going to be broken and is wholly inept, which I agree with Dr. Jessica, but what can we do in the meantime? And they call it the bully pulpit, or the hearts and minds, and start to shift the market from the conversations that people are having in HHS and beyond. So as a pragmatist, as someone that helps individuals get healthy, I'm excited about this.
All right. Do you want to, maybe Jessica, you could address the nutritional guidelines, because as I understand that the nutritional guidelines actually changed about 14 or 15 years ago.
Yeah, let's talk about the dietary guidelines. I do want to say one thing just about the underpinning of MAHA and this conflation between science and policy. We do not have policies right now that are evidence-based. So that is the crux of the issue with the MAHA movement, is that they use that framing in order to erode trust in science. We do not subsidize corn, wheat, and soy because the evidence tells us that's what we should be doing. We do that because that's what's most profitable. Because in the 1970s, Earl Butz, who was the head of the USDA, decided we needed this go big or go home strategy, and it was much more efficient to have people go, okay, well, you guys are growing 100 crops on your farm. That's not efficient, right? Let's make this much more efficient, much more profitable, so that we can export those crops. Let's turn all of the farms into monocultures, and so you're only growing one crop. You're growing either corn in the Midwest. Corn grows great. It's super efficient. Grow corn, and then we can export it, and we can make a lot of money. That is, the scientific evidence never said to start subsidizing corn, wheat, and soy. And so this conflation of science and what policy has been enacted in order to prioritize profits at the expense of people's health is a real crux of the MAHA movement, and it's the real issue with the MAHA movement that people in public health and in science have with this movement. And it seems quite intentional to erode trust in science. And if you look back, you can look at all public health advocacy has been there. I've been in this fight. Many public health experts have been in this fight trying to advocate for better policy, because the policy has not been evidence-based that we use in this country. With the dietary guidelines, they also use this idea of the food pyramid. I went and got my hair blown out yesterday, and the woman talking to me was like, she asked me like what I did, and I never like to tell people I'm in nutrition these days, but I did on accident, and she was like, oh, you're not talking about the food pyramid or telling people about the food pyramid, are you? First of all, the food pyramid has not been used in 20 years. 20 years. 2005. In 2000, now it was my pyramid from 2005 to 2011, and this is just, it's a visual representation of the dietary guidelines. So actually the dietary guidelines have not changed all that much. over time because nutrition science research hasn't changed all that much. But the food pyramid that we all think about when we think about the food pyramid that they are all talking about stopped being used in 2005. It's been my plate since 2011 under the Obama administration. Our dietary guidelines are evidence-based. And this, it's very odd to me that we pretend that they're not. There's very strong nutrition science research to show our dietary guidelines right now recommend making half your plate fruits and vegetables, getting a variety of proteins, making over half of your grains whole grains, eating as many, if you look in the dietary guidelines right now, go look at them. They recommend eating as many whole food, nutrient-dense foods as possible. Those are the dietary guidelines. They mirror dietary guidelines all around the country, or all around the world, I should say. Other high-income countries have dietary guidelines very similar to ours. Limit added sugars, limit saturated fats, limit refined grains. All of that in our dietary guidelines are also in other high-income countries' dietary guidelines. They're very, very close. There's very few differences because we use nutrition science research from all around the world when we make these recommendations. It's not like we're just doing research in the United States of America and that's the only research we use. We use it all around the world. And so when we're thinking about like making big changes to people's health, we should also understand 90% of Americans, over 90% of Americans do not meet the dietary guidelines that we have right now. They never have since the introduction of the guidelines. Since the early 90s on up, no one's ever met them. And we have lots of evidence to show that if people did meet those dietary patterns that are recommended in the guidelines, they would be far better off health-wise. But 90% aren't meeting them because we're eating too many calories for our needs. We're not meeting fiber intake guidelines. 95% of us aren't. We're not meeting vegetable guidelines. Over 90% of us aren't. And so the issue is that we've never actually met the guidelines, not the dietary guidelines themselves. So if you change the guidelines that no one is following, no, it's not going to move the needle on health.
But the dietary guidelines, as we said, it is based on science. So I 100% agree with you. It's based on profits. All this stuff, there's so much conflicts of interest. But these loopholes that are happening in public schools, when certain cereals could be counted as like a whole grain, or pizza is considered a vegetable. I mean, that is based on these dietary guideline loopholes of, well, if we meet these thresholds, this cereal is considered a whole grain, or this pizza is considered a vegetable. So what are your thoughts on that? I'm curious on, like, do you think that's a good thing, or
no,
we should close those loopholes?
We should close those loopholes.
I agree with you.
But that's not because of science. Science is not saying that pizza is a vegetable.
Right.
The food industry is saying that pizza is a vegetable and
100%.
Lobbying our Congress people to say that pizza is a vegetable.
They cherry pick the science to prove it.
Yeah, but that doesn't mean that like the science is bad. That doesn't mean that vegetables are
No,
the science says
100%.
eat more vegetables.
But it's they use science to substantiate it. So when a cereal is slapped with heart healthy, they are basing it on cherry picked science to say that whatever cereal it is heart healthy or high in fiber, but it's ultimately still an ultra-processed food, or at least a minimally processed
Just
food.
last thing on that, because I think this is really important, but that's not the science. So we agree on the issue. We agree pizza shouldn't be a vegetable. That's not because scientists are saying pizza shouldn't be a vegetable.
That's a huge win right there.
If nothing else, guys, you learned that.
There's the point of agreement.
I feel a hug
because
coming
of the
on.
food industry. No, it's because of the food industry. That's why. And for people that don't know, pizza was considered a vegetable because of the tomato sauce on the pizza. And so the industry lobbied to have tomato sauce, a certain amount of tomato sauce, a small amount, be considered a vegetable so that they could meet the vegetable recommendations in school lunches. So that's where we need to focus on, putting regulation on the food industry, changing our campaign finance reform so they can't lobby politicians to say pizza's a vegetable.
Right. And tomatoes aren't even a vegetable. So they have to get that right.
Well, I mean, if you really want to get into it, vegetables don't exist.
That's a different panel.
In botany.
Yeah, right. Can I say one other thing?
Yeah.
So would we, Dr. Jessica, would you support Secretary Kennedy pushing Congress to increase funding for public schools to improve lunches? Because I know they want to do that.
Of course. Can I just interject for a second?
Because I will support that too.
But there is a bill that was authored by Cory Booker and has, I think, 3 or 4 Democratic co-sponsors that's been lingering languorously in the Senate for 2 or 3 years. And so there is real legislation that has been sitting there. And maybe it's been the Democrats or progressives' fault for not championing that as vociferously as they should be. But there's real legislation there and not just sort of handshake deals between HHS and food companies. So I would really encourage people to look at that. Like you said, Bernie Sanders has the Childhood Diabetes Act, also with a number of Democratic co-sponsors, been sitting there well before the MAHA movement. So I think that, Democrats have been a little tone deaf on this issue and have, in essence, let the right kind of own this issue because they don't talk about the stuff that they're doing. So, so just one more thing is that I think you both agree that there needs to be more regulatory measures put on runaway, unfettered capitalism, big food, big ag, etc. But I think a lot of people associate this administration with deregulation. And so what you see is these deregulatory policies, particularly flexing their muscles, across the environment, but other places too. And what we actually need is a government more willing to dull the sharper edges of capitalism.
Yeah. I'll say one thing is that,
I'm just the moderator.
No, clap for Jeff, guys. Don't give up on that. So my thought is, look, I'm not an economist, so I don't get on a diet, devolve into this. But I'm not sure that it's actually capitalism. I think that this sort of subsidies and corporatocracy and crony capitalism certainly. But these industries, these multinational corporations, are protected by the government. It's not a free market. It isn't completely set up to have cheap, ultra-processed food. That's not ultimately capitalism. That's protectionism of these massive companies. So, because if actually was like the consumers could pick and would be empowered, they may pick some of the vendors out here, but the odds are stacked up against the American people because of this corrupt system.
So that's absolutely not true. And that is definitely a talking point from one of the highest people up in MAHA who kind of helped to orchestrate the MAHA movement. When you
I thought up that myself.
Do you think so? I mean, I've heard somebody else say it a lot too.
No,
okay.
It's my thought on this. Yeah, but
listen, the entire reason that under our economy, what is the primary responsibility of a corporation? It's to maximize profits and growth. And that is the primary value, right? At the expense of all other values. Food corporations aren't out there to make us sick. They just don't care if we get sick. They care about profits and growth, and they need to show that to Wall Street every 90 days. And so when you are trying to maximize profit and growth, what are you going to do? You're going to cut costs. How are you going to cut costs? You're going to look for the cheapest ingredients possible. We as a government subsidize, again, corn, wheat, and soy, right? Those are the cheapest ingredients possible. And so they are going to use corn, wheat, and soy. They're going to use, if we have policies that, we have economic policies that we put quotas on the amount of sugar cane that can come into our country, and while we're subsidizing corn, guess what that does? That makes corn a lot cheaper to produce. And so what are food manufacturers going to do? They're going to use sugar that's made from corn, not sugar that's made from sugar cane, right? Because it's just cheaper. It's not like it's a nefarious act and that's what they're going to do. It's because it's cheaper. And so that's what they do. The entire reason that corporations lobby is because of the capitalist society that we live in. And I'm not an anti-capitalist. I just think that we should have honest conversations about the pros and cons. And one of the cons is that health, wellness, public health, those aren't priorities under a system like that. And so what you have is you have corporations looking out for their own best interests. You have them looking out for profit and growth. They're going to lobby politicians to enact laws in their own favor, and that's what we see happening. And so when you say that corporations making ultra-processed food is not capitalism, it's exactly capitalism. It's the function of capitalism and why these corporations are making these low-nutrient, ultra-processed foods that people eat a lot of.
Yeah, I agree with you 100%. So I'm not saying that's a form of capitalism. I'm saying that it's these sort of subsidies. It's if you actually look at the definition of like a free market, these subsidies and legal shields and preferential treatment to industry is not true free market capitalism. But look, I'm not an economist. But all I'm saying is that the government's involvement with these industries, it lowers these prices. Of course it's about profit. I don't think that these big food companies are out to poison America. I don't think that at all. But it's because it's cheap. It is because it's nutrient deficient. It's killing us. So to me, I'm excited to hear that if we can get HHS to push Congress to increase funding for public schools to get more fruits and vegetables, to close these loopholes, to reform SNAP and be really focused on whole foods and make it more accessible, I'm all for that. I think it's a great thing.
You brought up SNAP. Can we talk about SNAP?
Let's talk about SNAP. That's an uncontroversial topic. I'm glad you brought it up.
Why'd they bring it up?
Oh, man,
you
SNAP.
opened the door, so.
Yeah, you said it first, Will. You're going to regret that.
I know. Sorry.
Okay, so SNAP is our Supplemental Nutrition Assistance Program. It's the most important program we have for reducing food insecurity in our country. 13.5% of the country live in food insecure households, which means they don't always have access to the nutrients, the nutrition that they need to meet their nutrient needs. Not necessarily calorie needs, but nutrient needs. So more nutrient-dense foods. So SNAP helps to directly reduce food insecurity. Despite what's in the media, it's an incredibly efficient and effective program. It directly reduces food insecurity by 30%. And it's economically efficient. Every dollar that goes into SNAP generates $1.50 to $1.80 in economic activity. So it's efficient and it's effective. It does its job as is. Now, in public health, we have debated SNAP restrictions for decades. I've only been a part of it for the last decade and a half, but this has been talked about. In 2023, Cory Booker and Marco Rubio put forward bipartisan legislation to trial soda restrictions on SNAP. It seems common sense. It seems, how could you fight against soda restrictions on SNAP? Let me just explain the other side of why there has been debate, and it hasn't been just like, yes, let's go put the restrictions. The reason is because I just explained it's a very efficient and effective program. And what we know is that when you put additional restrictions on it, it can decrease the efficacy of the program. And so if you put additional restrictions on it, it increases costs, so it's not as economically efficient. But also, we don't know if it actually will decrease consumption. And so that's why this bipartisan legislation to trial it was really important. Like, let's see if it's even worth the extra cost. Because what's going to happen, it's a supplemental program. The average benefit is $7 per day per person on the program. So it's not a huge amount, and it's certainly not all of their grocery budget for the majority of people. And so it's very possible that they just may use their SNAP dollars for whatever else. Maybe they just didn't think about it before because there weren't restrictions, but they'll still buy the soda. They're just not going to use that other $7. They'll use the $7 on something else. And so it won't actually decrease consumption of soda. We know that people on SNAP do not have different eating patterns than income-matched people who are not on SNAP. There was just a report out last week that showed they eat in the exact same way. There's very different variability between how these people eat. And so SNAP is not the mechanism by which people are consuming the soda. And so if you increase restrictions and you increase those barriers and for no measurable health outcome, then that's a problem. And we don't have any data to suggest that it would actually meaningfully improve health. It would just be a barrier on accessibility.
It's interesting. I've seen studies that say differently, and I'd love to get your thoughts on it, and like the context of it all. I think it was a Stanford study that said that cutting out soda from SNAP would prevent obesity in, I think, 171,000 kids. There's like 250,000 decreasing diabetes, type 2 diabetes, in 250,000 adults. I've seen statistics of say the kids on SNAP drink 43% more soda than kids not on SNAP. There's someone that's on SNAP has double the risk of obesity versus the equivalent. They're eligible, but they're non-participants to SNAP. I look at that data, right? I am not looking at all the SNAP people in the world, but I see statistics like that where we are paying for foods that I see on a daily basis feed chronic disease in people. And then the majority of people on SNAP are on Medicare, Medicaid, and the majority of those people are on medications that we're also funding. So we're funding to treat the chronic disease or manage the chronic disease for that we fed in these people, or at least participated in some degree. I know there's free will involved, and you're right, they may find soda in another way, but to me it seems like such an enabling, such a pandering, such a feeding of this chronic disease versus saying, no, we want to set you up for success. We want to break generational cycles of disease and not have it completely be funded by the American government.
Yeah, so restricting their ability to have soda is not going to enable them to get healthier, though. So if we wanted to enable them to get healthier, we wouldn't cut almost $200 billion from the program and restrict people from having access to SNAP. And also, we would look at the actual food environment. So what we've done is we've built a food environment that sets people up for failure. People living in food deserts, people who don't have ready access. I just said 13.5% live in food insecure households. We've built this food environment, and now we've said we're going to fix the problem by restricting people's ability to choose their groceries in an incredibly efficient and effective program. And so again, I'm actually not anti-soda restriction. I'm pro, let's trial it out and see if it actually keeps the program efficient and effective. I'm anti-pretending that it's going to be this revolutionary health outcome, which none of us actually know if it is.
What do you think of the Stanford study, the things like, where are they getting that
so those
data?
are modeling trials.
Okay,
so
I believe that. Yeah.
All of that is modeling studies because we haven't actually looked at what happens in free living individuals. And so there are some modeling studies that look at if you take soda away, and the modeling predicts that the consumption will come down. But what the debate is will consumption actually come down? Will they swap it for juice? Because you can still buy juice. Will they just use their extra money and increase their soda consumption there? And so or will they swap it for like some other unhealthful food?
But even if, to me, it's like at that point, I'm not saying that someone on SNAP can't have soda, but why are we paying for it? So to me, that's the bigger thing of like, why do we stop there? Why don't we have alcohol in SNAP? Why don't we have other things in SNAP as well? Because to me, it's like there has to be a line. I hear you. It may not change.
Where do you...
But I do agree with you. Just knowing people, they'll probably find a way to find their damn soda. But why should we be subsidizing it? Ultimately, and you talk about these big food companies, if we cut subsidies, SNAP subsidies to these big food because they're not covered by SNAP anymore, isn't that a good thing?
We subsidize these corporations.
No, but
all
I'm
the
saying
time.
if they can't be covered by SNAP, it would be helping to not put that more funding, federal funding, into these big food companies.
Shouldn't we just regulate the food companies?
That too.
Right. Yeah.
I agree.
Yes.
There's no regulation at the big food companies.
Both and. I agree with you.
I don't necessarily agree with like going all the way downstream to when like the lowest income people are like purchasing their food to try to like do something about the food corporations. I think that we should regulate the food corporations.
I think you probably can generally agree that we need to stop big food companies like Coke from externalizing their costs, right? So they don't pay for the Wegovy or insulin or metformin related to the diseases that they cause, right? So this is why they're able to show big profits, because they can produce their product for below the true cost of production through subsidies, and then they don't actually have to pick up the societal costs for that. So maybe we can just close the
I think
bracket
also a lot
that
of this is like hypotheses, right? And that's been the crux of it. We are hypothesizing that like when we do these changes, something will happen, but we don't have any data to suggest it actually will. Where we do have good data is if we regulate food corporations, if we put a soda tax, like a sugar tax on soda. Like I don't know why we're not going after evidence-based public health policy, and instead we're regulating what low-income people can purchase with SNAP while cutting SNAP funding almost $200 billion. Because I'll tell you, this has been the party in power's goal, has been to put restrictions on SNAP, because what happens is fewer people use the program. And so what happens is food insecurity increases when fewer people are using the program because they have shame or it's difficult to navigate the system. Because it puts up more barriers, fewer people use it. And so it's an efficient and effective program that is cost effective. And it seems like it's a very ideological thing to focus so much on this particular program when it's just not a major driver of our health issues.
It's my understanding that SNAP has doubled since 2020. I think it was about 60 billion to whatever, and it hasn't come down to pandemic levels. So I what are you referring to when you talk about SNAP being cut? Because I've seen the spending really come up, and it's not come back down to pre-pandemic levels. But
Are you not aware that it was cut in the
the big
bill?
beautiful bill? Yeah. So
is that an actual? I haven't seen the numbers come down. It's still billions of dollars, hundreds of billions of dollars.
So just passed in July.
yeah, and it's not meant to
2020,
enact
it was at 60 billion. In 2020, it was.
So-
Look, and let me say this too: cutting. Sorry, Jeff.
No, you're good. I love you.
It's like we're spending more money than ever before in human history on chronic disease and funding these federal programs, and we're sicker than ever before. So to me, it's like spending more money on a broken system isn't necessarily the goal. So when people say, "Oh, the funding is cut," as if that's a bad thing, where as far as like statistics go of like Western nations, we're one of the sickest. So, and I don't know the exact, like the big beautiful bill and the exact numbers of talking about hundreds billions versus 90 billion. Who knows? It's billions. But at 2020, it was at 60 billion.
So supplement use has gone up, and we're buying more supplements than ever before, and chronic disease rates are high. Should we get rid of all supplements?
Most of them.
So that's a correlation. So yeah,
Except yours.
a lot of things.
Except my vitamin D.
A lot of things are high right now, higher than ever before. So again, very important to understand correlation versus causation. We are not in a chronic disease epidemic because of our amount of public health funding and our public health programs. Again, and that's a really easy kind of way to defund public health programs, which is exactly what the administration in power has been attempting to do since their first term.
Yeah.
And so again, that's a misdirection and misguided in terms of their messaging on this. That's not the reason that people are sick is not because of Medicare and SNAP. The reason people are sick is because of what I discussed in the beginning, where we have built systems in this country that are set up for the vast majority of us to fail. And spending is going to go up because people are getting older, people are getting sicker. During COVID, that was when SNAP benefits were increased, and that's why there was such a big increase. And what we saw during COVID was that those increases in benefits were very efficient. It directly decreased food insecurity. Food insecurity did not go up, even under a huge economic crisis. And so it was effective at doing what it did. And now they're coming back down because some of those, expired. But that was an effective kind of program in terms of being able to decrease food insecurity.
I don't disagree, SNAP as a whole, but I think reforming it and really focusing on incentivizing healthy food, it should be the goal, and not subsidizing foods and drinks that feed chronic disease. But it sounds like you're still open to that if we can prove it, not just modeling studies.
I've always been open to the idea that we should trial restrictions and see if it's actually evidence-based.
Let's have more science like that to show that.
I lived in New York when Mayor Bloomberg tried to outlaw the big gulp.
Yeah.
Everyone remember that? And it was like, nanny state, get out of here, right? And
the Heritage Foundation took out a full-page ad.
On the other side. But so I want to kind of return to something that I touched on in the introduction, because I think that there are a lot of really well-intentioned human beings I'll say like my wife, one of them, who, sorry to call you out here, but that, grew up like feeding our three daughters, kale for breakfast. And I don't want to have an argument about kale, by the way. I'd say organic food for breakfast, fiber and a good bolus of protein. She was slightly vaccine skeptical and wanted to learn more about the schedule. She always reinforced a lot of movement, all of the things that I think that are endemic to what one might dub now a Maha mom, right? That a lot of really good intentioned people really believed in preventative medicine and healthy food and saw that within a constellation of other policy issues like sane climate policy and women's rights as all kind of go as a thing that all went together, right? Maha comes along and provides that constituency a movement, right? And I think that that's why it has been so popular, that prior to this moment, there hasn't really been a codified movement around a lot of these things. So there's this kind of bubbling up of this movement. A lot of people are talking about it, a lot of podcasts, et cetera. Then Bobby Kennedy comes around as the sort of anointed leader of that movement, is more or less shirked by the Democratic Party, and so makes a Faustian bargain with Trumpistan and basically joins an administration and delivers a constituency, a number of votes to try to get an administration elected that is now administering broader policies that I think will make Americans much sicker. Like, for example, the deregulatory policies related to the climate, or cutting SNAP benefits or slashing Medicaid to the degree of $1 trillion, but while also empowering a certain sector of the government in HHS to make some incremental changes, the removal of chemical additives, right? The conversation that we're having more broadly about ultra-processed foods, et cetera. And just personally, I don't actually know where to stand within that equation. Is it worth it to have this conversation at the expense of the other broader things that are happening policy-wise within the administration as it pertains to health, and then as it pertains to democracy is a different panel?
Yeah. I hear what you're saying. And I'm coming at this from solely a health place and a pragmatist place. And HHS is just HHS. It's not the EPA. It's all this other stuff. But I'm willing to celebrate wins where they come. As I mentioned, cheering on Cory Booker, cheering on Bernie Sanders when they talk about these subjects, cheering on Michelle Obama back when she wanted to make a garden and then Big Food made her switch it to exercise. I was cheering her on too.
Now it's a ballroom.
Now it's a ballroom. So to me, I can say, yes, these things are good. Oh no, I don't like these things. And then that's the sort of compromise and corruption that's within government, which is beyond my pay grade. I can't speak on all of that. But I think what's happening with conversations around SNAP reform, and I hear you maybe need more studies to show versus modeling studies. I think we need more science in these areas. I think looking at the grass loophole that they're now finally discussing is a great thing. You okay?
No, I'm fine.
Okay. Looking at 30 states, beyond even a federal level, there's 30 different states looking at labels and ingredients, red and blue states. So I think that this is, pragmatically, I'm excited about not just the changes that are happening at a federal level, but the hearts and minds that are changing. And I think, there's an awakening happening in our country, and we can celebrate the wins, even if it's from the other side. And I don't follow everything that Dr. Jessica says, and I told her this before the call. She's a great communicator. People love her. She's very talented. I think she's Maha and doesn't even know it, to be honest with you. Because the reality is wellness She doesn't know it. That was the point. The reality is wellness has always been diverse. Our community has always been diverse. And it's okay to have different opinions and have diversity of thought. And it's, to me, this tribalism that says, well, if a Republican says it, it can't be good, is messed up. Okay. And I'm curious real fast, though. We know you don't like Secretary Kennedy. Who's been your favorite HHS secretary in American history?
Yeah, that's not an important thing for me to answer.
Well,
why?
What have you done? What HHS secretary do you like the best that you thought is a gold standard that Secretary Kennedy should be like? And have you ever complained about them on social media?
So there's no political tribalism with me. I don't know why you're acting that way. You say you guys.
Is that true?
Hold on.
Yeah.
Okay, hold on. Reel it in.
Hold on.
Okay, Jessica, you got the floor.
Respond to the entirety
sure.
of what he said.
You got it.
And particularly about the idea that we should just kind of like go with, what my stance is if it's pro public health, I'm all about it. I wrote an entire article about RFK Jr. Trying to close the grass loophole and talking about closing the grass loophole in support. So this idea that I am tribal and I'm not going to agree with or accept things if they actually get done and they're not just talked about in terms of being done. So a lot of what is being done in the MAHA movement, you think that I'm MAHA and I don't know it. I would say that maybe perhaps you are pro-public health and don't know it, and perhaps you should listen to public health experts and scientists who have been in this fight for years and have not been able to make any changes because of politics and because of the money in politics.
I hear you, Jessica. I don't disagree with that at all.
Well, the movement does, because the movement is not working with any experts in this area. The movement is intentionally eroding trust in anyone who's been working in science or public health for the last many decades, and that is the biggest issue. The movement has pitted science against pro-MAHA people, and whereas the vast majority of people in the MAHA movement would be on the side of many of us who have been working in public health. We want the same things, and we understand the policy behind what actually has to happen. We understand for the last 40 years of data what policies can actually move the needle. And so when I'm trying to point out these policies are actually not going to move the needle, and by the way, while we're focused on swapping the color of Skittles, all of these programs are being cut that are doing the exact thing you guys say you want. You want local food systems. All of these programs are being cut for local food systems. You want small regenerative farmers. All of these grants are being cut for small regenerative farming. You want to improve chronic disease. The people who are most afflicted with chronic disease at 2 to 3 times the rate of anyone else, a 15-year life expectancy age gap for men and a 10-year life expectancy age gap for women, are the lowest income people, and the two strongest public health programs we have to improve their health, and there is an incredible amount of data on this, are Medicaid and SNAP. Almost $1 trillion was just cut from Medicaid and almost $2 billion from SNAP. And guess what? In the SNAP program, you like to talk about how we just want healthy foods for SNAP participants as if we all don't want people eating more healthful foods. They just cut SNAP Education, which was the education arm of SNAP, an incredibly effective education arm that literally taught low-income people how to prepare their healthy foods. There are programs, incentive programs, which is what we have focused on in public health, which are called Double Up Bucks, which are these incentive programs where if you go for $1 of SNAP funding, you get and you spend it on fruits and vegetables, you get twice as much fruits and vegetables for your $1. Those are really effective programs, and those are at risk right now. So I think that's the issue. It's the misdirection.
HHS is not the entirety of the government. I 100% agree with you. All that stuff you're saying, I agree with you. There's so much corruption. It's a profit over people. 100% agree. But I have never heard you say anything positive about the grass loophole or anything positive. I don't know if that would get you as much engagement, because if you
does.
It does? Okay. Yeah. But to me, I just see it as being one-sided. Where if I would love a randomized control trial on what you're saying and saying, well, Bernie Sanders said this, and everyone, you would love it. But if Secretary Kennedy says it, you don't love it. And I just feel like there's this sort of tribalism over saying, yeah, I don't love all the other stuff about the Republican Party, but I do like this, this, and this. I haven't heard you say that, but again, I haven't been exhaustive of all the things you...
It's just not true. If Secretary Kennedy proposed evidence-based solutions and actually had policy, I would be the first to champion it. I have always said that, and that remains true.
Right.
And I have also talked to Cory Booker about anti-science things that he said. Okay. And I've gone after him, and not after him, but I've talked to him about it. And he literally, he responded to me in the DMs. I sent him a long message about how he was purposely spreading anti-science information. And he came back and said, thank you so much. Like, that's opened my eyes. That's really helpful.
I appreciate that. I have not heard that. And going back to something that I did say, so you don't think there's a HHS secretary that was like your favorite?
Yeah.
So HHS secretaries historically are not like these celebrities. They're not out there with social media accounts making programs. They're trying to do the inner work of public health. And the HHS secretaries that I appreciate are the ones who actually work with the scientists within the health agencies.
All while chronic disease has grown over that time.
That is not because of the scientists within public health agencies.
I'm sorry, this lady was distracting me.
Well, I think I
think this is really very important to understand. We're saying chronic disease has grown, and that's the way that this administration is justifying cutting all of our public health agencies, which are really the only part of the government that is looking out for anyone's health. The vast majority of the rest of the government doesn't care about our health, and they care about profitability. Public health is what does care about our health, and we're just cutting all of the programs. In Trump's 2026 budget, he's trying to cut the CDC by over 50%. The CDC is what tracks disease. We just had an outbreak of botulism in infant formula that was caught from people in public health who were not getting paid during the government shutdown, who identified that outbreak so it doesn't spread anymore, and we were able to trace it. And we're trying to cut all of these programs that are looking out for our health. And this administration, which has tried to do that for the administration, especially since their last administration during Trump 1, has tried to cut federal funding for these public health programs, but they always faced a lot of pushback because that's the one arm of the government that looks out for us. And now through this movement, through this messaging, it's been a gift to this administration because it's been intentionally eroding trust in science and public health, the only area of the government that is trying to help keep us healthy. And now they're able to cut the programs that they've always wanted to cut.
Do you feel like HHS and the MAHA movement is really, we're the ones, whoever we are, the loose coalition of people are really is what eroding trust? Do you think it's been the behavior of the institutions that have eroded their own trust, and people just have eyes to see and ears to hear?
The former.
That's a different, yeah. We have a different opinion of that.
Yeah.
To me, I think that they're the cause. We're looking at what they're producing. They are failing, but we are eroding trust at the fact that they are failing. No, I just think people are calling what they see.
Let me give you a really good example of how MAHA is eroding trust, and it's not actually the institution. People in the MAHA movement will go on, whatever shows there are, or they'll go on social media, and they'll say that the FDA is funded by the same industry it's meant to regulate, and so it's completely corrupt. That is intentionally eroding trust in people who do not understand why the FDA is and how the FDA is funded the way that it is. That's not the FDA eroding trust. That's the MAHA movement eroding trust in the FDA. Because the FDA has, by the way, public health has chronically been underfunded for decades, right? And so in the early 90s, they didn't have enough funding to keep up with regulatory oversight of pharmaceutical medications. So pharmaceutical medication, pharma was going through these drug trials. They were like, we need to go through this regulatory oversight, and there was this huge backlog. So instead of Congress allocating more taxpayer dollars to the FDA, what they did was they said, okay, we're going to implement user fees. Just like most regulated industries have user fees, there's set user fees. And there's lots of different things that you have to go through in order to kind of go through this regulatory oversight. But with those user fees of pharma, they were then able to hire more people to go through proper drug approvals. Now, that is very different than the FDA being corrupt. That's Congress saying, okay, we're going to allow you guys to have user fees. So when you go on a show and say the FDA is corrupt because they're funded by Big Pharma and not explain that the reason is because that there was this backlog and we wouldn't use taxpayer dollars to adequately fund the FDA. And so just like the airline industry where there's user fees in order to go through inspections on planes and any industry that's regulated, pharma now pays a very set fee for user fees to actually go through this regulatory oversight. So that's not corruption. And so when you go out there and you say, oh, this is corrupt, and by the way, let's talk about the solution. If we don't want that, and public health experts, we have many times said, you guys, we should definitely do away with these user fees because it'd be much better to get taxpayer dollars funding this. You got to talk about that side of it. What does that look like? Are you going to get public support for increased tax dollars going to the FDA so that we can all fund, the trials and the regulatory oversight? Or are we going to continue to have the pharmaceutical companies fund the fact that they are going to have their drug trial reviewed and then they're going to actually be able to make money from all of that pharmaceutical medication? So is it the taxpayers or is it the FDA? So the issue is that it's not being discussed in a genuine way. If we discuss it in a genuine way, then we can say, okay, what's the better option? But when it's discussed in a way that it's just like the FDA is corrupt, we should cut 50% of its funding, that's the problem.
Yeah. We're out of time, sadly, and I think this is why it is so important to have longer, nuanced, complicated conversations like this, because that answer is very difficult to explain on Instagram, even though you do a good job at doing that, an excellent job. And just in summation, I think, you guys did a fabulous job at actually listening to understand each other and not just to respond. So thank you for that. I would say just for everyone here, because this is in the zeitgeist. We're all having this debate vociferously. Thanksgiving's around the corner. You might have to have it at the Thanksgiving table. And I want you to all use some of those techniques of really listening to understand, seeking connection and not always solution. Because if you're just clapping for one of them and not the other or back and forth, try to actually open your mind and be open to new information. So thank you, Jessica. Thank you, Will. Thank you, Eudemonia. Oh, there we go. I want in. No. Great job. Thank you.